Hello everyone, welcome back to the Mat Corner. This is Sayeda Bukhari and today we're going to be discussing about the skeletal system. So let's begin. We all know that the skeletal system is the support system of the body, but it consists of two parts, the axial skeleton and the appendicular skeleton. So the axial skeleton is the one that is the main framework of the body, that include the head, the vertebral column, the ribs and the sternum, while on the other hand the appendicular skeleton is the one that include the bone of the extremities, that is the upper limb and the lower limb. So all the bones of the upper limb and the lower limb are included in the appendicular skeleton. Now, if we talk about what is the bone itself, so the bone is a connective tissue that is consisting of the cells. So the cells of bone are termed as the osteocytes. The bones do have a superficial thin layer of the compact bone around a central mass of the spongy bone, which is the marrow, where the blood cells are formed. On the other hand, the bones also serves as a reservoir for the calcium and the phosphorus. And if we talk about the classification of the bones, so the bones are classified according to their shapes into the long, short, flat, irregular, and the sesamoid bones. Now let's just discuss about each of them in detail. Let's begin with the long bones. So the long bones include the humerus, radius, ulna, femur, tibia, fibula, metacarpal, and the phalanges of the hand and feet, and they have a shaft which is termed as a diaphysis and the two ends, that is the epiphysis. So the epiphysis are the upper end and the lower end of the bone, and the diaphysis is between the two epiphyses of the bone, which is marked over here. And if we talk about a close look, you guys can see that the compact bone is the one that is surrounding the medullary cavity or the spongy part of the bone, which is making the cells. So which cell they are making? They are making the blood progenitor cells. So let's just do a quick review about the long bones. So the long bones are the one that are having the epiphyses which are present at the end. So they are having the two epiphyses, one at the proximal end, one at the distal end, and they are also having the diaphysis, which is the shaft of the bone. So the bone having these features, that is having the epiphysis, the diaphysis, the compact bone surrounding the medullary cavity. So that bone is termed as a long bone, and these are the features that are present in the humerus, radius, ulna, femur, tibia, fibula, metacarpal, and phalanges of the individual. Now moving to the next one, which are the short bones. So the short bones are the one that are of a small size, as the word referring short means small in size. So they include the bones that are present in the wrist and the ankle. So the wrist include the carpal bone and the ankle include the tarsal bone. So the ankle and the wrist are the short bones, that are the carpal and the tarsal bones respectively. So this is all about the short bones. Now up till here we have covered the long bone, the short bone. Now moving toward the third one, that is a flat bone. So the flat bone include the ribs, the sternum, the scapula, which is present at the back, and the bones in the vault of the skull. So the skull bones are the part of the flat bones. Now you should be wondering that what's different about these flat bones. So the flat bone have the articular surface, but that articular surface is covered with the fibrocartilage around it, which is the unique feature of the flat bones. As for your better understanding, I have pasted a picture over here. You guys can see that all the bones that are marked over here in the red color are the flat bones. So each of them is a flat bone, as the bone of the skull, the ribs, sternum are the part of the are not the part are the individual flat bones. Now moving toward the fourth one, which are the irregular bone, then we will have the sesamoid bone, which is the last. So the irregular bone include the bones of the mixed shape. So they include the bones of the skull, some bones of the skull, not all, some bones of the skulls. So why I am saying the some bones of the skull? Because we have discussed earlier that the some bones of the skull were the flat one. So here, which one are the irregular ones? So the irregular one are the ethmoid, the sphenoid, the palatine, the temporal bone, the zygomatic bone, and the maxilla and the mandible and the inferior nasal conchae, which are present in the nose, and the hyoid bone, which is present in the neck region. or around the thyroid. So these bone of the skull are the irregular one. Okay, now apart from the skull, where are the rest of the irregular bone located? So the rest of the irregular one are located in the vertebrae and the coxa. So coxa here is referring to the coccyx, which is the tailbone which is present below the sacrum vertebrae. And if we talk about the more details of the irregular bone, so the irregular bone having mostly the spongy bone that is enveloped by a thin outer layer of the compact bone, while in the long bone there was a thick outer layer of the compact bone, and there was a low space of the spongy one. So here we have the most spongy part of the bone and the thin layer of the compact bone around it. Okay, so that was too much, but we are good to go to the last part of the video, which is the sesamoid bone. So the sesamoid bone are the very easiest one. So these are the bone that develop in the certain tendons. And what is the purpose of this bone? These bone reduce the friction of the tendon. So these bone protect the muscle from tearing around the joints while doing the movements, and are commonly found where the tendon cross the end of the long bone in the limbs, that is referring to the joint, as in the wrist and the knee. The one example of the sesamoid bone is the patella, which is present at the knee joint. In the tendon of which muscle, you have to comment it down in the comment section. So this is all about today's video. I hope you guys do understand it, and if you do so, then make sure to like and subscribe to the Math Corner and comment down if you have any query. See you all in the next video. Take care.